Hello and welcome to Effortless Mastery. Today we will be learning on the cutaneous innervation of the upper limbs. We are still on that series of the nerve supply of the upper limbs. Of course, this is the last thing we are learning. Whenever you hear the word cutaneous, what should it bring to your mind? Skin. Cutaneous should always bring skin to your mind. When you hear innervation, that tells you about nerve supply. So if I'm reading the topic again, cutaneous innervation of upper limbs, I would say nerve supply to the skin of the entire upper limbs. Now, the upper limbs is, the skin of the upper limbs, its nerve supply is subdivided into different parts. So very quickly, let's begin. Now, this region, of course, this is your clavicle, the bones here, the collarbone is your clavicle. This region, the skin around that clavicle region and above it is supplied by a nerve called supraclavicular, from the name supra, above, clavicular nerves. So it is what will supply this skin here. That's supraclavicular nerves. Now, beyond that, the main arm, remember we said this is arm, this is forearm, this is hand. So the main arm is subdivided anteriorly. Let me use the word anteriorly. It's subdivided into superior lateral. Let's get the words first. Lateral is away from midline. Medial is close to midline. So there is medial, there is lateral. So in the lateral, you divide it into superior lateral and inferior lateral. So that means beyond this side, I said that was supplied by supraclavicular. The main arm anteriorly divided into superior lateral and inferior lateral. Whereas this other side is like the medial side. So the skin of the superior lateral arm is actually supplied by a terminal branch of axillary nerve. The skin of the superior lateral arm, so around here is supplied by axillary nerve. The trick there is that's the same way place we have deltoid. That's the same place we have surgical neck. And if you remember, axillary nerve should wind around the surgical neck. It should also supply deltoid. So beyond supplying the muscle deltoid, to also supply the skin in that superior lateral arm. Then for the inferior lateral, so still lateral but inferior, for the inferior lateral arm, it is actually a branch of radial nerve. So radial nerve will supply the inferior lateral arm. Superior lateral is axillary, inferior lateral, radial. When you come to the medial arm is supplied by two nerves. Medial arm by intercostal brachial and by medial cutaneous nerve of arm. So the skin of the medial arm is supplied by intercostal brachial, which tends to supply the more like this axilla here. Costal, you know the words now. Inter means in between. Costal means ribs. Brachial means arm. So between ribs and arm. So it tends to supply like this skin of this armpit and the proximal arm. Whereas the medial cutaneous nerve of arm, from the name medial, cutaneous skin, nerve of arm, will supply the medial arm, but more like the distal part. So the proximal part and the axilla, skin of the proximal, the medial, remember all of these things we are saying is on the medial side. On the medial side, I have both intercostal brachial and medial cutaneous nerve of arm. Some books will just add them together, but the truth is that intercostal brachial supplies the proximal part and the region where we have the axilla, whereas the medial cutaneous arm, nerve of arm, will supply the distal arm, but all of them will be medially. All right, so that is that. For forearm is simple. Okay, then, yeah, let's still stay in front. For forearm is quite easier. For forearm, the lateral part of forearm, so that is lateral cutaneous nerve of forearm, is a terminal branch of musculocutaneous. When we did innervation, the function of the nerves, I had established that the word musculocutaneous means it will supply both muscle and skin. So for the skin supply, it is to the lateral forearm. Then the medial forearm, of course, has its own nerve, which is medial cutaneous nerve of forearm. So that is for the medial forearm. When we get, okay, I'll come back to hand. Let's now go posterior. We'll come back to hand. Let's go posterior. For posterior, it is still here. This region will still be supraclavicular. The superior will still be axillary. Remember. Now, the medial will still be the people you know that should supply medial. If I'm looking at it from this point, the small medial, you will still be the people you know, intercostal brachial and medial cutaneous nerve of arm. But the key thing is that the posterior arm is radial nerve. The skin of the posterior arm, radial nerve. Skin of posterior forearm is also radial nerve. So it makes it very easy. Remember when we learned, we realized that radial nerve will supply muscles of the posterior forearm and arm, and also supply skin of the posterior arm and forearm. So that is how it is. So the entirety of this posterior, both arm and forearm, is supplied by radial nerve. The superior-laterals, I repeat myself, for my arm, superior-lateral, axillary. Please remember this part here where we have the clavicle is supraclavicular. Superior-lateral axillary, inferior-lateral radial, the medial intercostal brachial and medial cutaneous nerve of arm. You go posterior, radial nerve. You come anterior again, but lateral. For the forearm, the lateral cutaneous nerve of forearm is actually from musculocutaneous. The medial cutaneous nerve of forearm is actually a nerve of its own from medial cord. Then the posterior is still radial. Now let's go to the last guy, which is the hand. For the hand is very simple. Hand is divided into the palm, both the palmar surface and the dorsal surface of the hand is divided into 3.5. So you divide it in your ring finger into 2 equal halves. So when you divide your ring finger, using your ring finger, you realize that you have 1, 2, 3. The ring finger is the fourth finger, so 3.5 and 1.5. And remember, if I'm in supine position, this is supine position, your hand this way. So when your hand is this way, your little finger is actually the medial part. So if you observe, when I divide it into 1, 2, 3.5, 3.5, the lateral 3.5 and medial 1.5. What always supplies medial 1.5 both in front and behind is ulnar nerve. Medial 1.5 both in front and behind is who? Ulnar nerve. Median 1.5 both in front and behind is ulnar nerve. But when I now go to the lateral 3.5, it differs. Lateral 3.5 in front, which is the palmar surface, is supplied by median nerve. But the lateral 3.5 behind is supplied by radial nerve. So for the hand, if I'm picking my hand, they ask you a question, what are the cutaneous innervation to the palmar surface? Palmar is in front. Palmar surface of the hand. Cutaneous innervation will be medial 1.5 ulnar, lateral 3.5 median. But if you come backward, you realize that medial 1.5 is ulnar, but lateral 3.5 is radial. But even the trick is that the nail beds posteriorly are still supplied, for the 3.5 are still supplied by median. So median will supply in front here, 3.5, and come back and supply the nail beds of those 3.5. Then the rest of the posterior 3.5 is by my radial nerve. So just to recap, for the top part, I have supraclavicular. For the top part, supraclavicular nerve. Now, assuming this is anterior and this is posterior, for my anterior, superior lateral should be axillary nerve. Axillary. Inferior lateral should be a branch of radial nerve. That is in arm. For the medial part of arm, the people you should have in medial arm was who? Intercostal brachial and medial cutaneous nerve of arm. When you come to forearm, the lateral part is musculocutaneous. The medial part is medial cutaneous nerve of forearm. I come to my hand, lateral 3.5. This is front, palmar surface, 3.5 will be median nerve, but 1.5 will be ulnar. When you come posteriorly, still supraclavicular nerve, the posterior arm skin is radial, posterior forearm skin is radial, the 3.5 radial. But remember the nail beds here are still the median that was in front. Ulnar is going to always be both in front and behind, 1.5. So that covers the cutaneous innervation or the nerve supply to the skin of the upper limb. I believe you understood totally. If you have a question, you don't understand anything I said, or you have a confusion about concerning a particular thing, please do well to type it out in the comment section. And if you have a topic you would like us to treat, feel very free to type it out too. Ensure you like this video, comment on this video, and share it to as many people as possible. Until we meet next time, thank you so much for joining us.